communities. Now, before I begin, can I ask you to please introduce yourselves on the chat function? We're very excited that so many of you have been able to join us for this webinar. ICM is really proud of the 50,000 Happy Birthdays project that's just completed after a little over 2 years of implementation in 3 countries. I'm sure that everyone on this webinar understands the importance of well-educated and well-trained midwives to ensuring that women, their newborns and their families receive high-quality care during the childbirth continuum. There is strong global evidence that midwives not only save lives, they also prevent complications, provide respectful care, uphold human rights, increase women's satisfaction in childbirth, and help build women's confidence as new mothers. We know that strong mothers mean strong families, and strong families mean strong communities. And this is what we all need for a positive future. I want to talk really briefly about the name of this project, 50,000 Happy Birthdays. We've taken the long view on this, and we've focused on how investment in the training of midwives can save lives, prevent complications, and improve quality care over the entire professional life of a midwife. Every time a midwife cares for a woman at birth, she can achieve many positive outcomes. A live mother, a mother with no complications or any birth-related damage, so no morbidity. A live baby, a baby with no complications or birth-related damage, no morbidity. And a high-quality experience where the mother and her family are satisfied with their care, and many, many more outcomes. In the course of her professional life, each midwife will care for hundreds of women, and every time she can influence positive health outcomes. Increased satisfaction for the mother leads to 1 happy birthday. How many more happy birthdays are achieved if that midwife also saves a life or prevents a lifetime of damage or trauma? Consider this conservative estimate. It's accepted internationally that the average caseload of a midwife is 50 women per year if she's providing all the care to that woman. And so over a career of 10 years and 500 births, one midwife can achieve at least 1 of these positive outcomes each time, and probably more, somewhere between 500 and 2,500 happy birthdays. What an amazing contribution each midwife makes to our world. This project invested in training more than 18,500 midwives and other health professionals to improve management of birth asphyxia, newborn prematurity, postpartum hemorrhage and eclampsia, and always integrating respectful care. A minimum of 18,500 happy birthdays if each midwife saves just 1 life each year. 74,000 if she saves 4. Or prevents 4 complications per year. When we take account of the numbers of births attended and the years of practice of each midwife, this investment in midwives will result in millions of happy birthdays. As a brief example, in this project, monitoring data indicated a 26% reduction in stillbirth rates in Ethiopia, a 57% reduction in newborn deaths in Rwanda, and a 33% reduction in maternal deaths in Tanzania. It's incredibly amazing, wonderful outcomes. I hope that you enjoy hearing more about this important project. And I'm going to hand over now to the 50,000 Happy Birthdays Project Manager, Florence West, who's moderating this webinar. Thank you all. Enjoy.
Thank you, Sally. I hope everyone can hear me okay. I'd like to acknowledge my dear colleague, Martha Bakosi, midwife advisor from ICM, who's based in Malawi. We worked closely in this project, and I'm blessed to have Martha's experience working on the 10,000 Happy Birthdays project, in which the 50,000 Happy Birthdays built on. I'd just like to acknowledge our speakers today from the midwives associations from Ethiopia, Rwanda and Tanzania, and also our dear partners at Ladle Global Health. Tori Ladle will be speaking from Japaigo Cherry Evans, and from Latter-day Saints Charities and American Academy of Pediatrics, Dr. Michael Visek, and of course ICM President Franca Kadei. So thank you all so much for joining us. The 50,000 Happy Birthdays project followed on from the 10,000 using the same cascade approach of training master trainers in each country, led by the midwives associations in each country, who then went on to train others in health facilities and education institutions using the Helping Mothers Survive and Helping Babies Survive modules. I'll just move to the next slide, please. So our arrows are a bit misaligned, apologies. Just some differences between 10,000 Happy Birthdays project to 50,000 Happy Birthdays project. In the 10,000, ICM supported Malawi and Zambia, and in the 50,000, Ethiopia, Rwanda and Tanzania, so we added another country there. In the 10,000, we're focusing on the Bleeding After Birth Complete module from Helping Mothers Survive and Helping Babies Breathe module from Helping Babies Survive. In the 50,000, we built on that to add preeclampsia and eclampsia, essential care for every baby and essential care for small babies. Also, the monitoring and evaluation system, thanks to our colleagues at Novometrics, for the 50,000 Happy Birthdays project included a midline, endline and quantitative health outcomes in the monitoring and evaluation, which produced more robust data from which we could inform future projects. And we learned from the 10,000 Happy Birthdays that an increased focus on low dose, high frequency practice and supporting education institutions was also very important, plus including other health professionals in the training, improved communication and collaboration. So we're really happy with the results from this project, and there's always learnings.
With this successful coordination under the leadership of the government at the Federal Ministry of Health at all level based, even at the sub-national and at down in the district and local government, I can say we really achieved a very important milestone through this project. It really added leverage our effort to reach to the milestone. And the best examples are Ethiopia has achieved more for the decrement of the preventable maternal mortality, newborn mortality, and child mortality. All this milestone is not happening like this without the contribution of the civil society associations, partners, donors, and the engagement of the academia and the engagement of the community by themselves. So with all this, with the excellent coordination and leadership, now we have a very important result with reduction of maternal mortality and then child mortality. But still, we have many assignments to do so far. Still, we have to work very hard on SDG milestones, particularly for the prevention of preventable maternal mortality and morbidity, as well preventable child and neonatal mortality and morbidity, and working on a very important platform with saving adolescent and youths, reproductive health milestone and nutrition. These are critical elements for us to really save mothers and children and youths and adolescents. These are the priority agendas at the ministry level. So with this, I would like to also appreciate, my sincere appreciation goes to the Ethiopian Midwife Association. For them, they are really a key partner with the Ministry of Health at any time point. They really support us, we support them. We really try to coordinate everyone, and we are really optimistic at any point level. And they are also a part of the technical working group for maternal health, also for the reproductive health as well. And we are also bringing them on board for adolescent and youth health. You know, this important milestone, working very closely, will really make us efficient. So I really reaffirm the ministry commitment to work very hard more than ever, and not only at the country level, but also we'd like to also partnering with other countries. Like I have seen lists of countries who are really presenting their experience, who are really committed to have experience sharing. I'm really keen to have that, like such a kind of partnership and communication and even experience exchange. And we really affirm our commitment. And I really thank you, everyone, and you both as a panelist and a chair for giving me this excellent chance. Thank you so much, and much appreciation for everyone. Thank you so much once again. Over to you.
Thank you very much, Dr. Meseret, for your time. I know you're very busy in the ministry, and your support to the Ethiopian Midwives Association has been outstanding during this project, and I'm sure it will continue. The big success of the project in Ethiopia has been the alignment with the mentorship project and program that the ministry coordinates, and I think aligning mentorship and supervision with training and support, it really helps to extend and scale up the interventions throughout the country. So thank you very much for your contribution and your kind words this afternoon. Thank you.
Thank you. Bye-bye. So should I leave the meeting or should I stay for some time?
You can stay and listen, or if your agenda is too busy, you can leave as you like.
Thank you. Perhaps I will hear the Rwanda's experience and then thank you so much.
Thank you too. Thank you very much. Moving on to Rwanda, I'd like to introduce Sister Angelique Mugarente, the Midwife Project Manager from the Rwanda Association of Midwives, to share her experience. As it's a short webinar and it was a really big project, we're trying to sort of spread out the topics so each project manager can discuss a certain topic, even though they could on their own speak for hours. We're asking Angelique to speak about the impact of the project in Rwanda on maternal and newborn health outcomes, please. So I'll pass over to you, Angelique.
Thank you very much, Dr. Florence. My name is Mugirene Angelique. I'm a Rwandan midwife, the project manager of MOA Happy Birthday project, and I was managing 50,000 Happy Birthday project activities. During the time of this project, RAM has been able to achieve 82.8% of the target. RAM trained the national facilitators, master trainers, and champion, and the total of these trained people was 6,626. Trained facilitators and master trainers are located in both pre-service and in service. We have now 7 teaching institutions, and in service we were in 31 hospitals, where we had 10 private hospitals and 21 public hospitals. And also in those public hospitals in the catchment area, we had 209 health centers. Trained facilitators and master trainers support and supervise trainers. In turn, trainers supervise champions, and this approach has helped to maintain and extend low-dose, high-frequency training, which is now one of the orientation courses given to newly recruited staff members. The low-dose, high-frequency approach represents the continuous on-site training and has had an impact on performance of healthcare providers. Their knowledge and skills have improved significantly and hence lead to improved prevention of maternal and newborn complications. The evaluation interviews conducted at the end of the project, 50,000 Happy Birthday project, highlighted that as a result of the training, health facilities are much better prepared to manage emergencies because staff have skills and equipment in their hands. Rather than simply referring emergency cases to secondary level of care, staff at primary health level reported that they are now able to stabilize the patient before transfer, and this improves the chance of mothers to survive. In addition to this, team spirit between nurses, midwives, and medical doctors has increased. The interprofessional collaboration became the key in team working. Under this project, RAM benefited some strengthened capacity building. Now RAM, as a baby association, has 2 RAM contractual staff who work the under 50,000 project. The 50 Happy Birthday project enhanced partnership and the collaboration between ICM and the professional associations. Before this project came, RAM scored 46% on implementation of MACAT. MACAT is a Midwives Association Capacity Assessment Report. And now RAM is scoring 82%. The implementation of 50K project has strengthened other partnership of RAM, including ongoing mentorship under intra-health Ingobyi activities. And today, RAM has 25 mentors, permanent mentors, located in 25 district hospitals under the support of intra-health Ingobyi. As you can see on the slide, an evaluation that was conducted by ICM on the health outcome of the 50K project in Rwanda showed that in RAM catchment area, the postpartum hemorrhage fatality rate reduced from 9 to in 2018 to 4% in 2019, while the total maternal deaths due to PPH were decreased from 10 to 6 cases. As for eclampsia, cases fatality rate reduced from 4 to 0%. Neonatal asphyxia cases fatality rate reduced from 18 to 17.6. And this from 2018 to 2019, maternal mortality was decreased from 0.11 to 0.09%, as well as the neonatal deaths within 24 hours decreased from 0.7% to 0.4%. During this project implementation, we met some challenges. I can say that the limited number of staff. From the beginning of the implementation phase until 15th May 2019, the project had only 1 staff, the project manager, to implement and oversee all project activities with support from RAM activity members. Training and service equipment was distributed during the training sessions instead of before the implementation phase. This was also one of the challenges. We had also the work overload in health facilities to do lower dose high frequency sessions. Trained staff turnover was one of the challenges, including also the first program manager who resigned at the middle of the implementation phase. Language was also the barrier. Training materials are all prepared in English version, while many healthcare providers are French speaker. Our geographical situation of health facilities in RAM catchment area was also one of challenge. As a way forward, RAM was qualified for the continuation and extent of 50K project for MOA 3 years. We are now starting MOA Happy Birthday project. Thank you very much.
Thank you very much, Angelique. I think I just nearly pulled out my headset. I was so excited. Thank you very much for your presentation. I hope it answered some of the Q&A that came through asking for specific results about health outcomes in the countries, and I believe you answered that. But if you have more questions for our attendees, please put them in the Q&A function, and we're happy to answer them during this presentation. I really liked, Angelique, you mentioned the increase of capacity of the Rwanda Association of Midwives. Out of the 3 countries, you mentioned that Rwanda Association of Midwives was the baby association, not meaning it's a baby, but it's it was the youngest association, the newest association, and it was amazing to see how with the support that we provided in country and virtually from ICM and the other partners, that improvements in the association, as you said, from 42% to 84% in aspects of financial management and governance and report writing and liaising with in-country partners increased, which of course leads to increased sustainability of the association and of the approach. So congratulations to Rwanda Association of Midwives, and thank you very much for sharing. Thank you. I'll pass on to Sister Lucy Mabada now from the Tanzania Midwives Association, who will speak about her experience and the country's experience with this project in relation to in-service training in health facilities and anything else, of course, that Lucy you feel is relevant to this webinar and to the project. So welcome to Lucy.
Hello, everyone. My name is Lucy Mabada from Tanzania Midwife Association, a former 50,000 Happy Birthday Project Manager. TAMA was started in 1992, and there is a very active members of ICM. I'm very happy to talk about the 50,000 Happy Birthday Project implementation in Tanzania to the hospitals, health centers, and the dispensaries, and we have reached about 376 facilities. First of all, the training is shorter than BMOC training, and also change of the focus from full day workshop. And we reach healthcare providers, include doctors, nurses, and midwives. And the training most of the time is on-site training. And I can say that is facility-based training to healthcare providers, and all health facilities equipped with simulators with establishment of practice corner. So facilities has mama natalies, mama birth, neonatally, prenatally, for them to practice when they have time. I can say the training is more suitable as the training practice embedded it into culture or into workplace. And this contributed to the quality improvement of care. Some of achievements you can see in our slide that we have reached about 2,200 midwives and other healthcare professionals. Also, women who died from bleeding after birth decreased from 50% to 11.7%. Women who died from eclampsia decreased from 4.2% to 3.1%. Newborn death reduced from 0.3% to 0.2%, and stillbirth decreased from 0.5% to 0.4%. Despite of limited resources of budget, manpower, time, high number of beneficiaries were reached, and also visibility and the credibility of TAMA, including membership, increased. Also, we can say we have trained in highly relevant, and our training is well accepted and very well with our country prioritized, but also those of recipient. Skills and the knowledge of beneficiaries improve greatly. Impact of quality of care and the confidence level. So I can say this is how Tanzania we improve our competence and the confidence of entire healthcare team. Thank you.
Thanks very much, Lucy. I remember some stories when I was traveling in the field about health in health facilities. The directors, when we met the managers and directors of health facilities, they were very excited about this project because it included the whole healthcare team. We know there's a shortage of health workforce, specifically in maternal newborn health. So often there's nurses, pediatricians, doctors, midwives, community health workers all working together. And some directors of health facilities were saying, oh, it's a really good project because everyone's included. And the midwives, the experienced midwives, support the junior doctors in their work, and the junior doctors now feel more comfortable working with midwives and referring to midwives to care for women. This project has managed to increase communication and collaboration, which is fantastic. I think there's also stories about cases being referred more early from outlying remote and regional centres to the main facilities for care, because early identification of problems and risk occur in these outlying centres, and the health providers feel more confident in their decision making to go, oh, this one needs referring and this one needs referring. And so the women and the babies would arrive at the big centres earlier, which would enable them to receive better quality care. So it was like a really wonderful experience to work with you, Lucy, and the team in Tanzania, and you did a fantastic job under very difficult circumstances, and I thank you very much for your work and for your presentation. Thanks, Lucy.
Thank you, Florence.
I think now I'm like going crazy on my screen looking at WhatsApp messages, and I think we're going to try to show the video again. Is it right? Let's see if we can get audio this time.
The day of birth should be happy, but this is not always the case. For mothers and babies in low-resource settings, it can be the most dangerous day. A well-trained midwife can make a difference. George is a midwife and a trainer in Malawi.
My mother died giving birth to me, and she died of bleeding. So that was the motivation. I wanted Lily to stop this kind of deaths. I decided and made a choice to become a midwife.
Following on from the 10,000 Happy Birthdays program in Malawi and Zambia, the 50,000 Happy Birthdays program will be implemented in Ethiopia, Rwanda, and Tanzania. The goal of the program is to improve midwives' capacities to save lives at birth.
To ensure continuous skill development, the program uses a low-dose, high-frequency approach, a method that provides midwives with short and frequent trainings in their facilities.
Team training at the facility level and having some sorts of support for ongoing practice is really critical. And not just numbers trained, but actually the outcomes that you'll achieve. And at the end of the day, we're looking to save more lives together.
The Midwives Associations will use simulation-based programs helping mothers survive and helping babies survive to train, equip and empower midwives, both in health facilities and education institutions.
This program is going to strengthen our association because it's going to add more members who will be trained and will strengthen their competences, and they will be supervised and mentored.
50,000 Happy Birthdays was launched in February 2018 with a delegation from the Ministry of Health and the Midwifery Associations from the 5 participating countries. Representatives from the International Confederation of Midwives, JPIGO, American Academy of Pediatrics, and Latter-day Saints Charities helped introduce the educational modules and project planning. We can already see the impact of this program. Baby Emmanuel from Zambia celebrated a happy birthday, thanks to the midwives who helped him breathe after his birth. We look forward to many more happy birthdays.
Great, it worked, technology, fantastic. Thank you so much for our support crew for enabling us to hear the audio, and thank you to Ladle for producing that video. It highlighted the project really well. Before we introduce the next speaker, I just want to address some of the comments. There's a lot of questions in the chat box and in the Q&A about sustainability, how to ensure sustainability. Some of our project managers touched on this slightly in their presentations. The main reasons we ensure sustainability, and Dr. Meseret also talked to this, is the collaboration with the Ministry of Health is a big factor. If they adopt the continuing professional development and pre-service education methodology of helping mothers survive and helping babies survive, the simulation-based and competency-based education and training methods, then that becomes embedded into the continuing professional development programs, which are already existing in many countries. Sometimes you refer to them as BMOC or EMOC. Every ministry includes continuing professional development for their health workforce. But using this methodology has shown to be more effective, and by including that, it becomes sustainable because it's adopted and aligned with current CPD programs. As Tachawat mentioned, the curricula in pre-service education institutions already includes topics to manage postpartum hemorrhage, obstetric emergencies, birth asphyxia, neonatal resuscitation. All these topics are already in midwifery education. So it doesn't take much just to change the way of teaching slightly to improve the outcomes for student performance, as Tachawat and others have mentioned. So I hope that answers some of your questions about sustainability. Now I'd like to introduce Dr. Cherry Evans from JPIGO, who is the Senior Technical Advisor for the Helping Mothers Survive Directorate, and just a fantastic colleague who's been with us since the beginning. And so Cherry is very, very busy woman, like full of lots of information and news to tell us. So Cherry, if you could please share your experience working with ICM and the countries in this project, and also a few updates about what's happening with Helping Mothers Survive. Thank you.
Yeah, absolutely. Thank you, Florence, and thank you to ICM for inviting me to talk briefly. You know, ICM and JPIGO have a really long history of working together with really good outcomes. The Helping Mothers Survive connection, however, began in 2011 when ICM, I have to say, provided much needed detailed feedback to the first module, Bleeding After Birth, the original one. They recognized that this was a really valuable tool to support midwifery competencies. I think somebody's getting ahead of me with the slides, but that's okay, I'll try to catch up. Thanks, you can leave it right there. So ICM recognized that this was a really valuable tool to support midwifery competencies for postpartum hemorrhage. And this feedback was by far and away the most detailed and useful to JPIGO of any of the consortium partners. So we could tell that ICM was very vested in this methodology for supporting midwifery competencies. So this collaboration continued after Bleeding After Birth was launched, where JPIGO helped work with ICM to hold various Bleeding After Birth trainings for their members attached to ICM regional conferences. And then it was actually ICM advisors, educational advisors, who were instrumental in pushing for advanced care skills to be pushed put into this module for Bleeding After Birth. And it was now Bleeding After Birth Complete, which is the module that was used in the 50,000 Happy Birthdays. That was launched in 2017. So while the HMS consortium you can see on this slide includes FIGO, ICM, UNFPA, American Academy of Pediatrics, and it's supported by Laerdal Foundation and the Latter-day Saint Charities, it's been the close ties with ICM that's really been instrumental to the success and the scale of HMS. For the 50,000 Happy Birthday Project, JPIGO supported ICM by conducting the training of trainers in the 3 countries. And it's good to see familiar faces on the panelists here today. This collaboration continues and it's ongoing. So ICM advisors, and Florence West was one of those, Dr. Florence, for providing feedback to the latest module, Essential Care for Labor and Birth. And it was launched not only in the US last fall, also in Namibia as part of the regional meeting. And what we learned there was actually invaluable to improving it right before the final launch. Go ahead and next. This collaboration remains ongoing as we prepare to pilot the next 2 modules, so prolonged and obstructed labor, one of the leading killers of women and newborns at birth, and then vacuum-assisted birth. So we're working on that right now. And finally, next slide, please. Thank you. So due to the advent of COVID-19, we really need to work even more closely with our partners to support quality of services. We are seeing around the globe that services for maternal and newborn care are falling off, in part because the attention of the health systems globally is elsewhere with the pandemic. So with the help of the instructional and graphic design team at Laerdal Global Health, we've adapted that latest module for Essential Care for Labor and Birth to be delivered using a blended learning approach. So it starts with e-learning, you can see on this slide, with thoughtfully sequenced videos that are already part of that training. We're connecting people with WhatsApp groups, and then these are interspersed with on-site team sessions. So with the advent of reduction in travel, we need to find ways to meet people where they are. And for us, that's meeting people where they deliver women. Next. I think this last picture that's just what the site looks like on e-learning. And again, critical is the on-site component for working with your team, skills practice, problem solving locally in real time. So stay tuned, we're looking to virtualize and create blended learning for some of the other modules as well. Over to you, Florence.
Thanks, Cherry. We're really excited to see the remote learning tools coming out, and ICM will be delighted to test these in countries in which we work for you. I think it's fantastic, and definitely in this trying time of COVID is a great solution to meeting midwives and care providers where they work. So that's awesome. Thank you so much. Michael Visick Dr. Michael Visick has been also part of the team for a long time. I'd like to introduce Michael, who has two hats, one for American Academy of Pediatrics and one for Latter-day Saints Charities, to talk about his experience from the baby side, and also to talk about what's happening next for the baby modules. Michael.
Myself here. Thank you so much, Dr. Florence. Had to get off mute there. It has been my great pleasure to work with this team, and I'm so thrilled to see all of you this morning, for me, this afternoon for you. Really, this was, as Sherry and as Dr. Florence have said, one of our first opportunities to work closely with International Confederation of Midwives on the ground in these three wonderful countries. And it was definitely the first opportunity for Latter-day Saint Charities to work with International Confederation of Midwives. And we were present in Zambia for the kickoff of this great project. And I would have to say this has just been an extremely fulfilling collaboration for all of us, with all the members that you see here, all the country project managers and professional associations, JPIGO, and most especially International Confederation of Midwives. If you want to just move to the next slide, we're not seeing the, let's go one more if it's okay, and then we'll come back. You're not seeing these wonderful women that I've had the privilege of working with for the past almost 3 years. These wonderful program managers and project managers, and Dr. Florence and Martha from International Confederation of Midwives have been absolutely amazing to work with for us at American Academy of Pediatrics and LDSC, and really appreciate their wonderful presentations. But what they have accomplished, they have just done with so much hard, earnest work, and really reaching out and getting to those areas of the countries that most need help for mothers and babies. Latter-day Saint Charities was able to provide some technical assistance. We were helpful getting some of the master trainers developed in these three countries for helping babies survive modules that they would go on and teach so successfully. And then we've also been able to provide a little bit of technical help with program management during the course of the project. And also we're able to some service equipment, bags and masks, stethoscopes, penguin suction for the actual midwives on the front line who are saving these lives and saving these mothers. That's been our great privilege. Because this has been so successful, Latter-day Saint Charities has wanted to continue this collaboration. We have decided to fund a project that we're calling More Happy Birthdays. You've heard that referred to from project managers. More Happy Birthdays is essentially a pilot effort for Latter-day Saint Charities in Rwanda. We felt like we wanted to continue this collaboration and try to better it. So we're going to build on the success of 50,000 Happy Birthdays with a couple of extra improvements. We want to continue to work with our colleagues at Novometrics and make data gathering, particularly at the point of supportive supervision. We want to be able to do that digitally so that we have better control of the data, and we hope we receive better data about the outcomes. We also have brought in Maternity Foundation as a partner, and Maternity Foundation is helping us work with the Safe Delivery app so that we can use this as a teaching tool. We can use it during supportive supervision, and we can also use it as low-dose, high-frequency practice. And we'll be able to collect data right from the app about who's practicing and how often, so that we can identify areas where we need to do more and areas that are being extremely successful, and that way improve our success overall. So we're very excited about that More Happy Birthdays project, that we're in an inception phase now and ready to move into our implementation phase, continuing with these great partners. Another aspect that was touched on, especially in Rwanda and Tanzania, has been the way that 50,000 Happy Birthdays has improved the visibility of the midwifery associations, but also the respect for our midwives that has increased substantially during this project, and that has been as a result of the increased competency and the increased skill level for midwives across the board. We'd like to also build on that and bring in some of our pediatric colleagues and our obstetric colleagues and involve them more in this process, in this project, to achieve even greater outcomes. We see a great strength in building relationships between all of our associations. As Florence mentioned, we are also working on ways that we can work better during coronavirus. And so with the World Health Organization, American Academy of Pediatrics has been working on Essential Newborn Care Now is the name for these digital tools. Laerdal Global Health has been integral in helping us develop some tools for helping babies survive modules that we can now teach and practice remotely, and we're very excited about bringing that new resource to you in the very next few weeks, and we're hoping to build on that as well so that we can return the appropriate focus to mothers and babies at this time, even as we deal with the pandemic. Speaking of these Helping Babies Survive modules, we are excited to remind you that this is the 10-year anniversary of Helping Babies Breathe. And we're going to be doing several activities in the next few months to celebrate this anniversary and the amazing success that Helping Babies Breathe and Helping Babies Survive have enjoyed thanks to your work over the last 10 years. And with that, I'll turn back to you, Dr. Florence. Thank you.
Thank you very much, Michael. Happy to celebrate the 10th anniversary of Helping Babies Breathe. And I think many of us here on this panel have contributed to the publication that will be in the Pediatrics Journal coming out very soon, September, October. So stay tuned for all of you research nerds who like to read about things in peer-reviewed journals and celebrate the 10th anniversary of Helping Babies Breathe. Thank you so much. I'd like to pass now to Laerdal Global Health, to the Chief Executive, Tore Laerdal, who will share with us his wisdom and learnings about this project and other future happenings to save mothers and babies' lives. Tore.
Yes, hello everyone. I'm thrilled to join this exciting webinar, and I've seen very many familiar names coming up on the chat box. So it's very, very nice to be with you all, and congratulations to everybody who has contributed to this success. I call my first slide, or title it More Happy Birthdays, to pick up the good name that Michael said that LDSC has put on the continuation of the project in Rwanda. I was asked to say a few words about scaling up, and I think there is really no more better word on that than talking about more and more happy birthdays. Next slide, please. We heard Sally at the opening talk about what is really a happy birthday, and without repeating that, it's important to stress it's more than saving a life. It's avoiding morbidity. It's also giving an exciting, positive birth experience by a mother-friendly or respectful care. We heard 18,500 lifesavers have been trained. So if they only can influence with a positive experience 3 happy birthdays a year, we will have reached 55,000 more happy birthdays every year. And I think that is a phenomenal achievement. But the focus, next slide, of this program was really on avoiding preventable deaths, where also amazing results have been reported. And it's about 2 programs that have been developed, and we've been very pleased to work closely with JAPIGO for the Helping Mothers Survive modules, and American Academy of Pediatrics for the Helping Babies Survive modules. They started out with Helping Babies Breed in 2010, and by now, next slide, they cover literally the full continuum of care, and 85%, up to 85% of the death causes for both maternal and newborn deaths. So that whereas it started as a focused resuscitation program, it is now a bundle using the same evidence-based training methodology throughout. And as shown on the next slide, we have been privileged to help to provide the educational design for these programs. They all use these action posters with a color-coded action diagram. And we have been able to work closely with the other developers and the partners to provide affordable and quite solid training simulators that can make this a very practical, case-based, scenario-based, and peer-led training program that can roll out in a cascade model, as was shown in the video. Next slide. Over the past 10 years, much have happened to these programs, and first and foremost through an alliance that's called Survive and Thrive. That is a continuation of the original Helping Babies Breed alliance, and over 17 years, and extrapolating this up until the current situation, we believe there is solid reason to estimate that over 800,000 birth attendants in 80 countries have been reached by one or more of these programs. And the main achievements of the program was really to document that this is an evidence-based transformative training methodology for both maternal and newborn care. It has been embedded in as much as 30 national programs, and that is very much the success of the sustainability and response to the sustainability question, of course. Also, as highlighted in red, the implementation of these programs demonstrated that strong professional associations are a pathway to sustainability. And both the pediatric societies, nursing associations, and of course midwifery associations have played a very significant and growing role in securing the sustainability of the program. In summing up the Survive and Thrive Alliance in 2017, next slide, there was also, could I have the next slide? There was also a list of, or a symposium, expert meeting gathering representatives of all the 20 partners of the Survive and Thrive Alliance. And the result of this was to establish the best practice implementation principles. And there are 10 of them. I highlighted 3 that I think are particularly important for this webinar. The importance of securing ministerial health buy-in. Number 5, the importance of identifying and supporting local leaders and champions. And number 9, establishing systems for reporting and feedback. But the other points that are too many to read cover also essential parts of this experience. Next slide is illustrating that it typically may take as much as 10 years or even more for a good concept to prove itself to be solidly documented, to scale up and to travel towards really mainstream, where it's embedded in Ministry of Health programs and national health budgets. And you see that this starts in 2010 with these alliances, and the 10,000 Happy Birthdays program, which we were very privileged and proud to work with ICM on in Malawi and Zambia, was carried out in the 2016 to 18 period. And now the 50,000 program is building on that. So with the very positive results that have been reported, the hope is that, next slide, that this can continue to, there's an animation not working here, but you see two more arrows to the right, that the positive experience with 50,000 Happy Birthdays can be triggering full national scale up in the countries where that's taking place. And that further documentation of that experience can then set solid case examples for implementation in many more countries. There are four main criteria, I think, for funding further programs. Next slide. And they are exemplified here why the criteria set for a innovation to call for proposals for an innovation to scale initiative that we were taking last year jointly with the Global Financing Facility under the World Bank, and evaluating 320 proposals that came in, and we're competing for 5 awards of up to $5 million each. They were ranked according to whether the proposals showed a thoroughly proven concept, the quality of execution and the evaluation plan, the quality of the local organization and team capacity, and whether there was a good integration with Ministry of Health strategies. And this is really what will be decisive in taking this forward, and also going from further scale up and potential external funding to integrating this with Ministry of Health strategies. The Global Financing Facility is aiming at working with the Ministries of Health to establish solid investment cases. And what they're looking for is simply better solutions, meaning that we're looking for more impact for the same or lower budgets. And that is the challenge and the opportunity for really further scale up of the 50,000 Happy Birthdays. Because this is all about addressing the main reasons of death for both mothers and newborns. It's about doing it in a more educationally efficient manner that also enables ongoing low-dose, high-frequency training and better competence maintenance in the various institutions. So we shouldn't look upon this as it's adding cost. It is really doing the essential in a more clever way, and therefore that is the case for further scale up. I'm pleased to say that among the 320 proposals to DFF, a high number of them included the one or more of these programs. So the further you move towards integration with Ministry of Health programs, the more you will see bundled approaches instead of single interventions. And by now, I think both the Helping Baby Survive and the Helping Mother Survive programs have been very solidly documented and are ready for that integration. I can show you very quickly 3 examples if we take the next slides. This is showing the development from 50,000 Happy Birthdays influencing or being incorporated as part of a Saving Little Lives program that's really about kangaroo mother care and exclusive breastfeeding that aims at reaching or covering a population area of 37 million, and 2.5 million births over a 3-year period. So the essential care for small babies will be part of this program, and also resuscitation for when needed. So 50,000 happy birthday will live on in multiple manners. The next slide is showing Tanzania, where the Safer Birth program will now be scaled up with the funding from DFF to cover 30 district hospitals and 500,000 births over this 3-year implementation period. And this is taking in particular the Helping Babies Breed course for refresher training and bundling that with a number of interventions that represents this Safer Birth program. And there is ample information about this if anybody's interested on the Safer Birth website. The third country we heard a report from was then Rwanda. Next slide. And we also heard here that this is living on in a continued initiative by Latter-day Saints to then implement the More Happy Birthdays program. So all in all, I think we are in a very good track here. We should be all extremely pleased about what has been reported in this webinar. And my final slide is that may all birthdays be happy. These are 3 of the saves that result from this program. Thank you very much.
Thank you very much, Tori. Lots and lots of comments in the chat box and in the Q&A, thanking you and Ledel and your team for all your support and all your good work, and definitely from ICM as well, we really appreciate all the expertise that comes out of your team. So thank you so much. I'd like to pass to ICM President Franca Cadet. We hope all the questions, before I do that, I'm sorry, we hope all the questions have been answered in the chat box. I've been fielding them, as well as the communications team at ICM, and Martha and the communications team have been fielding the Q&A field. Please, if there's any additional questions or something we haven't answered in text, feel free to contact myself at ICM, and my email address will be shown on the last slide. So in the matter of time and getting you all off to your other very important jobs, I'll ask Franca to close. Thank you, Franca.
Thank you so much, Florence. And I must say, I feel quite humbled to be allowed to close a webinar that shows such really, really outstanding work that's been done by others and not by myself. And it feels like a real honor to be with such special people who create happy birthdays. I mean, what more would you want in life but to create happy birthdays? I want to thank the Midwifery Associations of Rwanda, Ethiopia, Tanzania, of course, Ledel, Chipaigo, Latter-day Saints Charities, and the ICM team. I saw 122 participants today, and many of you I have the pleasure to know. I think this project is such a good example of where quality, skills, and the human factor join as one, and I think that's what makes it so extremely strong. I must say that Sally's comments about the long view of the 50,000 happy birthdays, and that in the entire professional life of a midwife, I think as a midwife, I'm quite average. I've been with about 1,500 women giving birth. And so if you look at the amount of births that midwives do, the idea that every midwife could support around about 500 to 2,500 happy birthdays, I think that is quite amazing. And I'm personally quite interested in unexpected positive results. I think it might be interesting at some point to look at that. I'm not quite sure if you're aware, there's a kind of a technique called the most significant change technique, which is like a qualitative technique where you can look at positive outcomes that you don't expect. I think that there will be many. For ICM, I think this program is very much linked to our strategy of this last triennium, which is quality, equity, and leadership. quality-wise, we're improving midwives' competencies and aligning it with ICM's vision and mission. Of course, this program addresses the quality care, which is so crucial to improve experience of care for women and their newborns. When it comes to equity, we are combining in-service CPD for midwives and pre-service training for midwifery students, and that is a sustainable approach. And we're also stimulating competency-based training, which is embedded into CPD programs and education curricula. I think that's something we can be so proud of. And of course, women and their newborns are benefiting from consistent practice from their midwives and student midwives during clinical practice. And what I heard, what was quite interesting, especially Ethiopia, but I think it's quite a few countries, that you're reaching midwives in both rural and urban areas. I think that is just wonderful. Leadership-wise, of course, we are stimulating the leadership of our Midwifery Association and the leadership of midwives. I think also the leadership of ministries of health, who are seeing the positive outcomes and are really pushing for midwifery and mainly pushing for women and babies and health and the future. I think it also shows leadership that we promote teamwork. I've heard so much about the fact that within the 50,000 midwives, obstetricians, nurses, all healthcare professionals work together. And I think working together shows leadership. And of course, leadership of the team through collaborating as a team, because I think when you work as a team, you know you can achieve more. It's really great to hear that the project is moving towards more happy birthdays. I don't think we can have enough happy birthdays. And I really want to thank you all for your contribution. I wish the world millions of happy birthdays. Thank you so much.
Thank you, Franca, and thank you all the panelists for being with us this afternoon and sharing your time and sharing your experiences. It's very much appreciated. Thank you for all the hundreds of attendees who joined us to hear the experiences. Please stay tuned to our social media at ICM. We'll be presenting in September a more outcomes and impact focused webinar looking at the specific processes for monitoring, evaluation and learning, and the impact of this project on health outcomes and on sustainability and on Midwives Association capacity. So we hope you really enjoyed this process and experience-based webinar to highlight the wonderful achievements of the project of the 50,000 happy birthdays. And I wish you all good health and stay well, and please follow us on social media for more information and anything specific. Feel free to email me, Florence West, and you can see my email address is there, fwest@internationalmidwives.org. So thank you all so much for joining, and I wish you a lovely afternoon or day, depending on your time zone. Thank you.
Thank you.
Thank you.
Bye, everyone.
Bye-bye.
Thank you. Bye.
Thank you. Goodbye, everybody. Thank you very much for attending.
Goodbye, everyone. Thank you so much. Bye.